If you have flat feet, you've probably been told your whole life that they're a problem. Maybe a coach told you, maybe a parent, maybe you Googled foot pain at 11 p.m. and ended up convinced your arches are the root of all your suffering. Here's what I want you to know right from the start. Flat feet are not automatically a problem. But, and this is a big but, if you have flat feet and you're wearing the wrong shoes, doing the wrong activities, or ignoring what your body is telling you, they absolutely can become one. My name is Dr. Andrew Schneider. I'm a podiatrist based in Houston, Texas, with over 25 years of experience treating foot pain. I work with patients every single day who come in frustrated, confused, and honestly a little defeated because their feet hurt and nobody has ever taken the time to explain why. This is exactly what this video is for. This is part of my Foot Type 101 series where I break down the three main foot types and what they mean for your body, how to make smart choices about your footwear and your care. Today, we're starting with flat feet, what they are, how they affect your body, and how to know if you have them, and most importantly, what to do about it. Whether you've been dealing with foot pain for years or you're just starting to notice some, this video is going to give you real practical information that you can use. Before we do, if you're finding this helpful, please take a moment to like this video, leave a comment, and hit that subscribe button. It helps other people who are dealing with foot pain find this information, and that's exactly why I make these videos. So let's start with the big question. If flat feet aren't automatically a problem, why do so many people with flat feet end up in my office? The answer comes down to mechanics. Not every flat foot functions the same way. Some people have flat feet and move through life completely pain-free. Their muscles are strong, their body is adapted, and everything is working in balance. Other people have flat feet where the mechanics have broken down, where the arch collapses in a way that puts excessive stress on the surrounding structures, and that's when the pain starts. The key question isn't just, do I have flat feet? The real question is, are my flat feet causing a mechanical problem that's overloading my body? That's what we're going to help you figure out today. Let's make sure we're all on the same page about what flat feet actually are. When we talk about flat feet, or what we call pes planus in medical terminology, we're talking about a foot where the arch is low or completely collapsed. When you stand up, instead of having a visible curve on the inside of your foot, the entire sole makes contact with the ground. Now there's an important concept here called pronation. Pronation is a natural inward rolling motion of the foot as it absorbs the impact of each step. A certain amount of pronation is completely normal. It's actually necessary. It's your body's built-in shock absorption system. The problem with flat feet is that the arch collapses during weight bearing and the heel often rolls inward, and that rolling goes too far. We call this overpronation. Here's something that often surprises people. There are actually two different types of flat feet, and the distinction matters a lot. The first is a flexible flat foot. With a flexible flat foot, the arch collapses when you stand on it, but when you sit down or take the weight off, the arch reappears. This is the most common type, and it's generally more manageable. The second is a rigid flat foot. With a rigid flat foot, the arch is flat all the time. Whether you're standing or sitting, this type is less common, but tends to be more complex to treat, and it's often associated with underlying structural issues in the bones or joints. Knowing which type you have matters because it influences what kind of support you need and what treatment options are available. Now let's talk about what happens in your body when you have flat feet that are overpronating. When the arch collapses and the foot rolls inward excessively, it creates increased motion through the entire foot. And increased motion means increased stress on the structures that are trying to control the motion. Two of the most commonly affected structures are the plantar fascia, the thick band of tissue that runs under the bottom of your foot from your heel to your toes, and the posterior tibial tendon, which is the main tendon responsible for supporting your arch. When these structures are constantly being overloaded, they get inflamed, they get irritated, and eventually they start to hurt. But here's what a lot of people don't realize. The effects of flat feet don't stay in the foot, because your foot is the foundation of your entire body. When that foundation is unstable, it creates a chain reaction that travels upward. Overpronation causes the ankle to roll inward, which causes the shin to rotate, which puts abnormal stress on the knee. The knee compensates, which shifts the alignment of the hip. The hip compensates, which affects the lower back. I see patients every week who come in with knee pain, hip pain, or back pain, and when we look at the root cause, it traces all the way back to what's happening at the foot. Don't underestimate your feet. They are the foundation. When the foundation is off, everything built on top of it is affected. So what are the specific conditions that flat feet can lead to? Let me walk you through the most common ones I see in my practice. Plantar fasciitis is probably the most well known. This is the inflammation of the plantar fascia and typically causes a sharp stabbing pain in the heel, especially with those first steps in the morning. If you've ever gotten out of bed and feel like you were stepping on a nail, you know exactly what I'm talking about. Posterior tibial tendon dysfunction, or PTTD, is another big one. The posterior tibial tendon is working overtime in a flat foot, and over time, it can become inflamed, stretch, or even torn. This is actually one of the leading causes of adult-acquired flat foot, where the arch progressively collapses over time. Bunions are a bony deformity at the base of the big toe, and overpronation is a major contributing factor. When the foot rolls inward repeatedly, it puts abnormal pressure on the big toe joint, and over time that joint can shift out of alignment. Shin splints, that aching, burning pain in the front of your lower leg, are extremely common in people with flat feet, especially runners and people on their feet for long periods. Achilles tendon strain is another consequence of overpronation. When the heel rolls inward, it puts the twisting stress on the Achilles tendon it's not designed to handle. And knee pain, particularly along the inside of the knee, is very commonly linked to flat feet and overpronation for exactly the reasons I just described. The common thread through all these conditions is excessive, uncontrolled motion, and that's the key to understanding how to treat and prevent them. Now, how do you actually know if you have flat feet? There are a few simple ways to check. First is the wet test. This is a classic. It's easy to do at home. Wet the bottom of your foot, step onto a piece of cardboard or paper bag, and look at the imprint you leave. If you see a full, solid imprint of your entire foot with little or no curve on the inside, you likely have flat feet. If you see a distinct curve, a gap along the inside of your footprint, your arch is more intact. The second method is to look at your shoe wear patterns. Flip your shoes over and look at the soles. If you see significantly more wear on the inside edge of the heel and the ball of the foot, that's a strong indicator of overpronation. The third and most accurate method is gait analysis. It's something we do in the office. We actually watch you walk and sometimes run and assess how your foot is moving in real time. A gait analysis takes the guesswork out of it completely. It tells us not just whether you have flat feet, but how your flat feet are affecting your movement. And that's the information that drives real treatment decisions. So now that you know whether you have flat feet, let's start talking about what to do about it. Starting with the most important daily decision you make for your feet, your shoes. Not all athletic shoes are created equal. And for people with flat feet, shoe selection is generally one of the most powerful tools available. The goal with footwear for flat feet is to control the excessive inward motion, to give the foot the structure it needs to move more efficiently and put less stress on the surrounding tissue. There are two main categories of shoes that work well for flat feet. The first is motion control shoes. These are the most supportive category of athletic footwear. They have a very firm midsole, a reinforced heel counter, and specifically designed to limit overpronation. They're best suited for people with severe flat feet, significant overpronation. If your arch is very low, or your heel rolls in dramatically when you walk, or if you've been dealing with chronic pain from overpronation, motion control shoes are most likely your best starting point. The second category is stability shoes. These offer a blend of cushioning and support. They have what's called a medial post, which is a denser section of foam on the inner side of the midsole that helps to slow down and control pronation without being as rigid as a motion control shoe. Stability shoes are ideal for people with mild flat feet or those who need some control but also want a more cushioned, flexible ride. This is actually the most commonly recommended category for people with flat feet, and it covers a wide range of activity levels and body types. One thing I want to be very clear about: avoid neutral shoes if you have significant flat feet and overpronation. Neutral shoes are designed for people with normal to high arches. They offer little to no motion control. Putting a flat foot in a neutral shoe is like building a house on a soft foundation. Everything might look fine at first, but over time the stress accumulates and something gives way. Now, shoes alone are not always enough. And this is something I see patients underestimate all the time. They buy the right shoes, they feel a little better, and they assume the problem is solved. But for many people with flat feet, especially those dealing with chronic pain or structural issues, shoes are just the first layer of support. The next layer is orthotics. Over-the-counter insoles can provide meaningful arch support and help control pronation beyond what the shoe offers alone. That they're a reasonable starting point, especially if you're not yet sure how much support you need. But for patients with more significant flat feet or those who have already tried the over-the-counter options without enough relief, custom orthotics are often the answer. Custom orthotics are prescribed and fabricated specifically for your foot. They're designed based on a detailed assessment of your foot structure and your gait. They provide a level of precision and control that no off-the-shelf product can match. Beyond shoes and orthotics, physical therapy plays an important role for many patients. Strengthening the intrinsic muscles of the foot, the small muscles that live inside the foot itself, can meaningfully improve how the foot functions. A stronger foot is a more stable foot, and when the foot is more stable, it puts less demand on the passive structures like tendons and ligaments that tend to get overloaded in flat feet. I also want to address something I hear from patients regularly, and it's this: my flat feet don't hurt, so I don't need to worry about them. I understand that logic, but I want to gently push back on it. Pain is not the only indicator of a problem. Flat feet that are functioning poorly can be silently stressing your joints and soft tissue for years before pain shows up. If by the time pain arrives, the damage is already done, being proactive, getting the right shoes, getting evaluated, understanding your foot type is always better than waiting until something breaks down. Here's the bottom line on flat feet. The arch itself is not the enemy. Poor control of that arch is the enemy. A flat foot that is well supported, well managed, and moving efficiently is not a problem. A flat foot that is collapsing without control, stressing the plantar fascia, overloading the posterior tibial tendon, and sending that dysfunction up the chain to the knee, hip, and back, that is a problem, and it's a preventable one. The good news is that most people with flat feet, even those who have been dealing with pain for a long time, respond very well to conservative treatment. The right shoes, the right orthotics, the right exercises, these things make a difference. You don't just have to live with foot pain, you have options. If you've been dealing with foot pain and you think your flat feet might be part of the picture, I'd love to see you in the office. We can do a full gait evaluation, assess your foot type, and put together a treatment plan that's specific for you. The link to request an appointment is in the description below. And if you found this video helpful, please take a moment to like it, leave a comment, and share it with someone who might need this information. Subscribe so you don't miss the next video in the series. We're going to talk about the opposite end of the spectrum, high arches, what they mean, and why they come with their own set of serious problems. Thanks so much for watching, and have a great day.